Good evening, everyone. Sorry, I got a sticky note here. And thank you for joining us to the Spring ACP Connect event. My name is Patrick Zacher. I'm ACP President. And I started my term as ACP's President last July after serving as a member of ACP Council since 2020, representing District 2, Southern Alberta as a pharmacist. Before we get started, I would like to respectfully acknowledge that we are gathered on Treaty 6 territory, the traditional lands of the First Nations people in Métis Region 4. We are joined virtually by individuals from Treaty 7 and Treaty 8 territory, and from the 6 Métis regions. The roots of many modern medications come from the Indigenous people's traditional use of plants from these lands. I would like to mention that we are joined by ACP Council representatives, including District 1 Council Member Peter Masick. That was a very... District 3 Council Member, I actually don't think he's here yet. Okay, never mind, I'll skip him. Executive Member at Large and District 4 Council Member James Frobb. District A Council Member Laura Miskimins. And President-elect and Public Member Deb Manns is also joining us virtually this evening. And on behalf of ACP, thank you to each of our attendees for joining us. These events are a great opportunity to connect and learn together as we appreciate that you are here, either in person or online. I will now turn things over to ACP's Deputy Registrar, Jeff Wissel, to provide an overview of our session tonight.
Good evening, everyone, and welcome for being here tonight. It's so great to see so many people here this evening. Also, thanks to everyone for joining us virtually as well. Tonight, we are honored to be joined by patient safety advocate Melissa Sheldrick. Melissa is a patient and family advisor at the Institute for Safe Medication Practices Canada and a member of Patients for Patient Safety Canada. She has worked with pharmacy regulators across Canada and internationally to support the implementation of continuous quality improvement programs in pharmacies, in community pharmacies. We've recently started to work with Melissa at the Alberta College of Pharmacy, and I certainly appreciate her approach to change that involves candor, kindness, and humanity. And it's so meaningful to remember those things when working with patients. Melissa will share her story and discuss the importance of continuous quality improvement programs in pharmacies. ACP's Quality Improvement Project Lead, Brett Baumback, will then provide a brief overview of the new Continuous Quality Improvement Program that ACP is currently developing. Brett will discuss how this program will enable the reporting of practice incidents and good catches to facilitate learning and sharing in the interests of patient safety. Both Melissa and Brett's presentations will be emailed to everyone who has registered for the event tonight. So you will be able to refer to the slides and also link to the references within the presentations. After Melissa and Brett share their presentations, we will take a quick 10-minute break, followed by a panel discussion that will be facilitated by our Communications Director, Barry Strader. After the panel discussion ends at 8:30, we will open the floor for questions on any other topic for roughly a 10-minute question and answer session with the President and the Registrar. Just a note, we have a lot to cover this evening, so we'll need to be back from the break on time to get into the panel discussion. We're looking forward to an engaging and interactive panel discussion. As you listen to Melissa and Brett, I encourage you to consider any questions you might have so that you can join in on the conversation. For those of you who are joining us online, you are able to submit your questions via live chat using Twitch. Make sure that you've set up a Twitch account if you would like to submit a question, as you need an account to participate in the chat. With that said, I would like to extend a warm welcome to Melissa.
Amazing, thank you. Hi, good evening, everybody, and to those of you here and to those of you online, thank you for being here and thank you for taking the time to come and listen to my words and the story that I bring to you tonight about quality improvement and why it's so important in pharmacies across Alberta and across the country. Thank you to ACP for having me. It really is truly an honor to be here with all of you today. So you've heard a little bit about my background. Before I came into this world, I was a public school teacher for many years and worked with young kids, and then everything changed when we lost Andrew and we found out that Andrew died of a medication error. So I do want to start telling you a little bit about him. Where am I pointing this? There we go. This is Andrew. Andrew was a very busy boy and loved to be outside. He loved to be in the water. He loved to have a soccer ball in his hand. He loved to be always on the go. He was a very caring kid. We heard a story from his teacher after he'd passed away that there was a boy in his class who would often come to school having trouble and difficulties, and this one particular day, he was having a really hard day, and Andrew was very sensitive, and so he went up to the boy and he said, "Hey dude, you look like you're having a bad day. Do you want to go play?" And the boy totally calmed down, and they took the soccer ball and off they went. And we heard that over and over about him, about his caring and compassionate demeanor and his soul, his sweet soul. And so after he passed away, the school invested in a buddy bench for Andrew in his memory. And a buddy bench is where kids go when they are feeling lonely or left out. And they're taught that if they see somebody there, to go and invite them to play. And then they had those words inscribed for him in his memory. And so this bench remains at the school, and it really was such a beautiful tribute to his spirit and to who he is. And so Andrew developed normally. He was born on term and developed normally. He was about 5.5, and we started to notice that he had really difficult times going to sleep at night, and then he would wake up in the night. He was screaming and stomping his feet and agitated and having nightmares, and then not remembering anything in the morning. So we spent a lot of months exhausted and overwhelmed trying to determine what was wrong, what had happened. And we were referred to a sleep clinic to have a sleep study and have him assessed to see what exactly was going on. And so he was diagnosed with a sleep disorder called parasomnia. And parasomnia is all of the abnormal things that happen to somebody when they're sleeping. And in Andrew's case, it was that he went into his REM sleep cycle twice as fast as normal. So it's a sleep cycle. So if one cycle is disrupted, then all of the cycles are disrupted. And so when we spoke to the doctor and said, "Now what?" She said, "You can try tryptophan." And for me, I am not a science person. Tryptophan, well, that makes me tired after I eat turkeys. So it's an amino acid, it's in our food, it has to be safe. Okay, let's try that. She prescribed him 5 tablets daily before bed. And so we spent a long time crushing them and mixing them in applesauce, and you don't really crush them fine enough, so they get stuck in your throat and you have to cajole him to take it. But it worked. It worked, like almost immediately. He had an easier time going to sleep. He slept better. His days were better. His evenings were better. And so the following year, I took him back for another sleep study, and the diagnosis remained the same. And she said, if that's what's working, keep going. And I said, okay, but here's the rigmarole we participate in every night before bed. She said, you can take it to a compounding pharmacy, because there's no liquid formulation. What's a compounding pharmacy? I had no idea. So I just looked it up online. I found the one closest to home. I took it to them. They said, yep, we can make this. And it was fantastic. We picked up the bottle every 2 weeks, kept it in the fridge. He took his dose daily before bed, no problems. And we did that for 18 months. And then one Saturday in March, we were running our regular errands, picked up his medication, put it in the fridge. I gave him his dose before bed, and he didn't wake up on Sunday morning. And we just had no idea what happened. We just had no idea what happened. He was healthy, and he was well, and now we had to try and put one foot in front of the other and figure out how we live our life like this. And we remained like that for 4.5 months. And after 4.5 months, in July of 2016, the coroner's office called, and they told us that Andrew's medication, the tryptophan, had been substituted with baclofen, and it was mixed in the same concentration as his tryptophan, 3 times the lethal dose for an adult. And they told us that it was most likely an error made during the compounding process. And it started questions. What do you mean it was a mistake? What do you mean somebody grabbed the wrong bottle and mixed the medication? Didn't they look at the label? What do you mean this happens? This was all brand new territory for us. We had no idea. Then I learned that in Ontario, my home province, it was possible that nobody would know about this, that nobody would learn from this, and that nothing would change so that improvement would happen and this would not happen to another family. And that was not okay with me. That did not sit well with me. So I started a campaign raising awareness. I did local, provincial, national media. I had an e-petition online asking to meet with our Minister of Health to have a mechanism in place whereby community pharmacies were not only required to anonymously report medication errors and near misses, but also that there was a learning component that would come from it. That was really key for me because it was not okay that this could happen to somebody else. We were already taking this burden on. Our e-petition reached well over 20,000 people internationally, and we met with our Minister of Health. And although this was not within his jurisdiction, he was extremely supportive, and he asked the Ontario College of Pharmacists to begin looking at this kind of program immediately. And so in January of 2017, I was called by the Ontario College of Pharmacists, and they said, we want you to come. We want you to come. We want to hear from you about what this program needs, what people need to be safe in this province with their medication errors. And this was really innovative for the College of Pharmacists because they had never invited a member of the public to come and to be part of a task force like that, and to hear my voice, to hear my perspective, and to hear my lived experience and expertise. So I was, of course, happy to go and to work with them and to see their commitment and to bring them the why. And that's why I'm here with all of you, to bring you the why this is so important, and why we have to continue to strive to make changes to improve. And so on June 19th, 2017, it would have been Andrew's 10th birthday, and OCP announced that their CQI program would be phased into all community pharmacies. And so our program in Ontario is the AIMS program, Assurance and Improvement in Medication Safety. And those 4 tenets, report, document, analyze, and share, are key parts of the program. And if one of those tenets are missing, it is not a complete program. We have to be able to report the error or the near miss, we have to be able to document it at that store level so that we can analyze it at the local level, at the provincial level, at the national level. And then we have to talk about it. We have to share that learning. We have to find ways to communicate what we've learned. The other thing I like to share about the AIMS program and this logo is that the A and the S are Andrew's initials, and they're very deliberately placed there, and so I affectionately call this Andrew's program. So when I started all of this, when we learned that he died of a medication error, and I started learning about CQI programs and reporting, only Nova Scotia had this kind of program in place, and they'd had it in place since 2010. And so these 300 pharmacies or so, they were reporting robustly. And I tried to go from a federal level through Health Canada, and Health Canada said, no, you have to go province by province. And I said, okay, let's go. So here we are in 2024. We have 6 provinces who have their programs in place. We have Newfoundland and Labrador, whose program is coming online in July of this year. And we have Alberta and BC who are working really hard to move this program forward. And so I'm so grateful to the people across this country who are helping make this go. Because this is not only about me. This is about all of us. This is about you. This is about ACP. This is about everybody who has a role in this work. This is my goal, and we're getting there. I don't know when, but we're getting there. So I just wanted to share with you some of the findings from across the country, and I bring the statistics from Nova Scotia because they're really a great illustration of how these programs work. And you know, like I said, there were I think 305-ish pharmacies at the time who were participating in their Safety Net RX program. This was their quality assurance program. It still is. And thankfully, you see 82% of the errors that were reported in that 7-year period were near misses, right? And 17% did no harm. Great. But then there are still those who are being harmed by medication errors. And we get down to the bottom, and thankfully, there are only 2 death cases in that 7-year period. But those are 2 families whose lives have been turned upside down. And so, no number above 0 is acceptable. So that's why we have to work together, and that's why we have to continue to move this forward, to bring those numbers down. Humans are humans. We all make mistakes. But there are so many errors that are preventable, and so we have to work harder together to reduce those preventable errors. So I come to you with many different hats. I am Patient and Family Advisor at ACP Canada. I am an active member of Patients for Patient Safety Canada, and you see that those are 2 of the logos there on the action stream of that schematic that's there. CMERPS is the Canadian Medication Incident Reporting and Prevention System. And this is a collaborative of those organizations, Health Canada, CIHI, ISMP Canada, Healthcare Excellence Canada, which is a quality and safety national organization, and Patients for Patient Safety Canada, which I'll tell you about in a few minutes. And we have a collaborative agreement and organization where we can connect with each other and share data and share learning. And when we see these reporting and learning streams at the top there, we see that community pharmacies can have their errors, their error data sent to the National Incident Data Repository. That's the NIDR. And so what an amazing repository of information where we can go and find out what's happening across the country in community pharmacy, because chances are, if errors are getting through systems here in Alberta, they're getting through systems in other provinces. So this gives us a great way to be able to have a national viewpoint. And there's all of these other different reporting streams. And if we pull all of this together, if we continue to have that collaborative piece in place, then we will continue to make improvements. And one of the benefits of this repository is a provincial safety brief. So you can see from the data that is collected into the repository, you can see what's happening in your own province. You can see what some of the incidents, the most common incidents are, or the contributing factors. So lots of important information that comes from that collective, right? That this is not just one person or one pharmacy or one province, right? We do this all together. Incident analysis is such an important part of a CQI program. Determining what happened, how did it happen, what were those contributing factors. Andrew's case had a lot of contributing factors. The major one was that there was the substitution of the medication. But this safety bulletin is the one from his incident analysis, and it also outlines really actionable recommendations for multiple stakeholders, right? In his case, there's recommendations for regulatory agencies, the manufacturers, the pharmacy team. It is not just singular focused. And then that learning keeps on going, right? These are two examples of work that started from Andrew's incident analysis in 2017. And in 2022, the learning continues. So that piece is really important, and it's missing if there's not a CQI program in place. So why are these programs important? These errors, the harm that's happening from these errors, are not a Canadian problem alone. These are a part of a global problem. And we know that some of these statistics are really quite shocking. Harm from medication errors costs $42 billion, or 1% of the global health expenditure every year. And one person dies every day, and 1.3 million people are injured every year from medication errors. So these are big numbers, and so much so that in 2017, the World Health Organization started the Global Patient Safety Challenge called Medication Without Harm. And their goal was to reduce preventable medication errors by 50% in the following 5 years. In 2022, they renewed that because we're not there yet. It is an ongoing problem. It requires a wide mobilization of stakeholders, and globally, we all have to have that collaborative piece. They also have a Global Patient Safety Day every year, World Patient Safety Day. It's on September 17th. It started in 2019, this past year. The theme was Elevate the Voice of Patients, engaging patients for patient safety. And this is a really key part of any improvement program. I stand firm that an improvement program without the lived experience of the people who have been through it is incomplete. And so it's really incredible that the World Health Organization recognizes this and honors this. Last year, they invited me to come to Geneva to speak at the World Patient Safety Day conference. And so I was able to bring my story and my call to action to a global stage. So, you know, I feel like they put their money where their mouth is, right? They say, engage patients, here's patients. They allowed me the honor to begin the conference before the Director General spoke. And that was really, you know, for me, important. It was really important for them to be able to do that. So what is it? What is patient engagement? Well, have a look at some of the words on the slide, and you can sort of get an idea of what patient engagement, and it can look differently in different places. What does it look like in community pharmacy? It can look like having a conversation with your patients. Last week, I had to go and pick up a medication for my husband, and the pharmacist said to me, "Oh, are you using this off-label?" And I said, "Yes, he is." "Okay." And she walked away. And I thought, oh, that was a good start. that was a good start, but there was no follow through. I would have liked for her to say, are you using this off label? Yes, I am. Are there any side effects? How is it making him feel? Is it interactive with, right? All of those questions, that is a simple way to engage with your patients at the counter. What are your questions today? How is this making you feel? Is there other information I can help you with? Patient engagement can get much more complex, but I just sort of wanted to leave you with that little snippet for today so you can start to think about what that might look like in your pharmacy. I'm an active member of Patients for Patient Safety Canada. We are a volunteer-led organization, and we are people who have lived experience and have experienced preventable harm from healthcare. And we work with anybody who would like to work with us, government, researchers, regulators, students, anybody, safety organizations. And we bring that lived experience to the table. It's that last puzzle piece when you are trying to build change and improvement. So we have to, shame and blame and finger pointing has been really prevalent in healthcare for a long time. And if you tell somebody to be careful crossing the street, it doesn't mean they're not going to be hit by an erratic driver. Telling somebody to do something better or shaming them into getting them to do something better is not effective. It's not effective on so many levels. We have to start looking at a systems approach. What are the systems that are in play to prevent those errors from getting through? What are those systems that are in play that will protect the environment and the atmosphere from having those errors occur and reoccur? Because so many times errors reoccur. And when we don't stop and look at what the systems are and we don't analyze what's going wrong, we can't prevent that. And so James Reason has this Swiss cheese model of patient safety, and all of those slices of Swiss cheese have these holes in them, right? Like we know, and those holes in his models, they move around. And so perhaps one of those slices is technology, let's just say. Well, today the technology is working great. There's the holes are, they're all fine. But tomorrow there's a blackout and the technology is not working, and an error that could have been prevented by technology got through because the technology wasn't working. Maybe a double check wasn't done at the counter before somebody took their medications and a mistake was missed. So when all of those gaps line up, when all of those holes in the slices of cheese line up, that's when the errors get through. I would encourage you, once you get the slides, to read the incident analysis about Andrew's case, and you will see how all of the holes lined up to let that mistake get through. There were ways that it could have been prevented. One of the books that I read soon after I lost Andrew and I started to read to learn about all of this was Option B by Sheryl Sandberg, and she said, when it's safe to talk about mistakes, people are more likely to report errors and less likely to make them. Yet, typical work cultures showcase success and hide failures. Teams that focus on learning from failures outperform those who don't, but not everyone works in an organization that takes the long view. And that long view comes from education and experience. And so that is what we have to work toward. This is not a quick fix. This is not an easy fix. But together, we have the opportunity to be able to walk that path together. And we do that through a safety culture. And when we talk about a safety culture, this is the attitude and the beliefs and the perceptions that people have, the values in an environment that relates to safety. We're learning a lot more about psychological safety and, where it is safe to speak up. And there are so many ways that safety culture can be prevalent in a pharmacy. And there are so many places where safety culture is just missed. And unfortunately, that is one of the cultures where, mistakes happen. When there's no learning from them, then they continue to happen. Soon after Andrew passed away, I had to go and pick up medications for my daughter, and I got into the habit of, looking at the image on my phone and matching it with the pill and matching it with the vial. And this one day, I couldn't find the image on my phone, and I started to panic. And the pharmacist came over and he said, "Is everything okay? Can I help you with something?" And I said, "Do you mind, please, just take the bottle off the shelf? Can I see what was in the bottle and that it matches?" And he stopped whatever he was doing. He got the bottle off the shelf. He showed me what was in it. He talked me through matching everything, and everything was correct. And I said to him, "Thank you." And he looked at me. He said, "No." He said, "Thank you for double checking." And I was like, okay, this is a place where safety matters. He wanted to know that he did not make a mistake, and that was valuable to him. And I cannot tell you how valuable it was to me. So not a big thing, right? But really, really important. And so we have this safety culture ladder, and you can see as you start from the bottom and you go to the top, these are really mindsets, right, in our practice and how we work and what we think about in the daily, right, in how we have our day-to-day workflow. What is our safety culture like? What is your safety culture like? It's not until you get to the proactive rung, right, second from the top, that you start putting in those safety systems that are going to prevent those errors from happening again, that you are going to put in those prevention systems. So I mentioned psychological safety, and Dr. Amy Edmondson is a professor at Harvard Medical School, and she actually does a whole TED Talk about psychological safety and in healthcare. And I would encourage you to watch this. Just even those 3 minutes there, she talks about how, spoiler alert, she talks about how error reporting culture is higher in teams that function better, because they feel safe to speak up. They feel safe to talk about what the risks are. They feel safe to talk about what the issues are, because then they can work together and learn from them. Another important piece of culture that I want to bring to you, safety culture, is a just culture. And this is, the outcomes or the severity of an event should never determine or influence the response to an individual. And we see that in these CQI programs across the country, that they are operating under a just culture. Andrew's incident was not reckless. It was not done with intent. It was not done maliciously. There was no risky behavior. It was a human error. This does not mean that there is no accountability for improvement. There was accountability on the pharmacy that made the mistakes in Andrew's case. And so that's a really important understanding that I would like you to take with you tonight, is that when errors occur, it is not about who, it is about what happened. So with that, I hope that you are part of the puzzle, that you help to come alongside, that you help to make these improvements so that we can see that reduction in preventable harm from medication errors. And I would like to leave you with these key messages. There is a human life directly affected with every decision that you make as a pharmacy professional. Everything you do in the day has an impact on somebody and their family. Collaboration and communication are key to increasing safety. You are not alone. Ask questions, innovate, find the support that you need, find those safety culture champions, and work together. Establish a safety culture within your mindset and embed it into your practice every day. Work together to minimize and eradicate preventable errors. And we know that in the real world, this can be a challenge. But my ask of you today is to take that mindset with you and find a way to do that every day. And finally, find ways to engage with patients and families. There is a lot to offer. We have an important perspective that cannot be learned from a textbook. It cannot be learned in school. And it is a really important part of making your space safer for you and for your patients and for your team. And so with that, I want to thank you, and I will call Brett up to come and talk to you now. Thank you very much.
Okay. Well, I just want to take a moment just to really thank Melissa again for joining us here today. We're so fortunate to have her here with us to help ground us in the why. You heard Melissa mention that a few times in her presentation, and that's really what this is about. This is early in our journey of medication incident reporting, and so you'll see that in the information that I share, but we really wanted to start with the why, and Melissa's story, Andrew's story, is just so powerful and really shows us and reminds us, because it can get lost as pharmacy professionals sometimes, that there's a patient at the end of that prescription, right? And a patient with a life and goals and dreams and so many other things going on. And so thank you, Melissa, for joining us today. So my name's Brett Baumback. I'm a pharmacist. I graduated from the University of Alberta in 2007. I work with the Alberta College of Pharmacy, and my current role is as a quality improvement project lead. Prior to that, I was a pharmacy practice consultant for a few years, so I had the pleasure of visiting some of you out in the field and talking about quality improvement within your own practices as well, through a bit of a different lens, but always focused on patient safety. And so I'm really fortunate to be involved in this project now and bringing to life some of what Melissa's been doing with other regulators across the country. But I just want to start quickly with a bit of a moment of reflection. And just for all of you out there, those of you joining us online as well, just to think about a time that you might have been involved in a medication error, an incident, a mistake. Could have been big, could have been small. We know these happen, just as Melissa mentioned. So just take a moment just to think about that. And so I'll just ask for just an informal poll. Anybody out there, have you ever been involved in an incident? Just to put up your hand. So me too. So it's most of us in the room. Those of you joining us online, you can enter it in the chat as well if you feel comfortable doing that. And I just want you to think about how that made you feel. Even as you're recalling it today, how does that make you feel? So just think about the way you felt that day, the way you felt that night, in the week that followed. How did your colleagues support you? What did you learn through that process? What processes were in place to support learning in your practice? How did your patient feel? Do you know how your patient felt? What kind of communication occurred with the patient when that happened? Think about how you and your colleagues interacted with the patient. Are there things we could or should do differently? Did you welcome and value the patient's feedback? Did you follow up with them afterwards? Did you feel supported in doing those things? Now, this is just a moment of reflection just to get us, to again, just ground us in that experience, that human experience. No one ever wants to be involved in an error. But it's critical to understand that they do happen. And it's critical that we learn from them when they do. And that's really what we're here to talk about today. So I want to bring you back a few years and just talk a little bit about the strategic plan. So ACP Council released the 5-year strategic plan in 2020 for 2021 to 2025. And goal number 4 was really centered around data intelligence. Now that doesn't really sound a lot like what we're talking about here today, but if you dig into the key objectives, one of them was that information collected through centralized reporting of pharmacy errors will enable pharmacy teams to improve their practices. And so what does that look like? Well, ACP was tasked to develop a program for documenting, collecting, and analyzing medication incidents. But again, just to bring you back to the objective, this is really about improving practice. So where are we today? So again, just to reflect back on some of my experiences as a pharmacy practice consultant, I got to visit pharmacies all over the province and got to see how teams were already embodying many aspects of quality improvement and quality assurance. So documenting practice incidents when they occurred, investigating contributing factors, developing action plans to prevent future occurrences, and then monitoring those action plans and activities through quarterly reviews. But we all know that pharmacy teams are busier than ever before. Practice is more complex than ever before. And workflow is so important. And is it possible that these efforts on this slide are hampered by the current system in place, the paper-based system? Perhaps that system doesn't give them the opportunities and tools that they need to proactively take action and prevent risk. So that's where we are, but where are we headed? So the key, if we reflect back on Melissa's presentation, is really sharing those learnings. So one of the challenges with our current system is we're investigating root causes, we're identifying contributing factors, we're putting action plans in place, but often the sharing of that information stops right there. So it stays with that pharmacy team. So what if there was an opportunity to share that more broadly? But sharing really requires that safety culture that Melissa spoke about. Okay, and what's safety culture? Well, it's not just the things that we do, but it's who we are. It's our attitudes and our values about patient safety that shape everything that we do in pharmacy practice. And part of that requires that safety culture is just, meaning that you feel safe and supported and encouraged to talk about quality and to raise concerns. So Melissa also had a call to action to engage our patients. How can we bring patients into the conversation? How can we value the patient's contributions and feelings and experiences? How can we welcome those to be shared with us as a pharmacy team? And how can we share those learnings beyond the pharmacy environment? So I'm really excited today to be able to begin the conversation about a new CQI program, CQI Plus. We've been working with Melissa and many others to get this rolling. And CQI Plus will really empower that safety culture in Alberta community pharmacies through CQI processes and sharing of information about practice incidents. So central to this initiative is anonymous, mandatory practice incident and close call reporting using an online platform. So we don't have all the answers yet, but we do know some things about what this program will look like. We know that it will involve documentation and analysis of practice incidents and close calls using supporting technology. We know that it will involve anonymous reporting to a central database. And we know that it will include a CQI process to address and monitor quality in the pharmacy. So to support those things, we'll have self-assessments to help pharmacy teams proactively identify risk, resources to support the safety culture and just culture in the pharmacy, and training and support for pharmacy team members. And then we'll use that data to look at trends and insights from what's collected. Now, I do want to reiterate right here, we're talking about data. ACP will not see or have access to who was involved in an incident, who reported an incident. The only thing that this program wants to consider is what happened and what can we learn from it. And this is really key to that just culture piece. Everybody needs to know and feel confident that the purpose of the program is learning and sharing. So ACP needs to walk with registrants on this journey of just culture. So CQI Plus will be anonymous. It will be just. It will be focused on the proactive. It will be provincial in scope, moving beyond the pharmacy environment. It will be patient-centered. What it won't be is it won't be blaming or punitive. It won't focus just on the reactive. Reacting to an incident is important as well, but this will help us move further upstream into the proactive. And it won't just be pharmacy-centered. So what's next? Like I said, this is early. So today what I really want to leave you with, and I think Melissa's presentation will really help you do, is reflect. Just begin reflecting on that safety culture in your own practice. As you go to work tomorrow or your next shift, think about, what is the culture like here? Do I feel supported to talk about quality? And do I feel supported to talk about safety? How do I get that conversation going? So in the coming months, ACP will communicate program details and requirements to pharmacy teams, so you'll get to learn a little bit more about the how. Tonight we're really talking about the why, but you'll begin to learn more about the how. Pharmacy teams will begin to document and report practice incidents and close calls once technology is in place to do so, and we're aiming for a full implementation of this program by the end of 2025. So I'd like to leave you with a little call to action as well. So over the coming months, we're going to start to engage registrants directly, including licensees, proprietors, other stakeholders. If you're a patient safety champion, if you're moved by what you heard tonight, if you want to help get this program going, I would really encourage you to get in touch with me, and we can begin that process now. So I've got my email address here. The slides will be circulated to you as well afterwards. Come talk to me afterwards. I'll hang around as well. Love to hear from you. So thank you very much. And again, thanks to Melissa for sharing your story and Andrew's story. We're going to move into a 10-minute break, and it's going to be a tight 10 minutes. We're going to come right back at the 10-minute mark, and then we'll have a bit of a discussion and some time for questions at that point. And for those of you that are joining us online, just ask that you come right back at 10 minutes as well. Thank you very much.
Okay, according to my watch, that was a 10-minute break. Good job, everyone. Thank you for being patient with us and getting back into your seats. My name is Barry Strader. I'm the Communications Director here at the Alberta College of Pharmacy. And of course, I don't have to introduce the guests to my right, Melissa Sheldrick and Brett Baumback. We're going to start now with our panel discussion. So we have a couple of roving reporters out here in our midst. So Jeff and Greg have a microphone in hand. So if you do have a question, a comment, you want to share a story, share an experience, please just raise your hand and Greg or Jeff will get to you. If you are part of our online audience, we encourage you to use the chat to ask a question, join in the conversation, share your thoughts. We'd love to hear from you. First off, I'd just like to, again, thank you, Melissa, for making the trip out from Mississauga to join us here today and then tomorrow in Calgary. So we really appreciate you spending the time and traveling across the country to see us here tonight. And thanks for your work as a patient safety advocate and doing that really across Canada. And my first question for you, Melissa, is can you share with us why you decided to take on these roles, these responsibilities of working with pharmacy colleges and eventually with ISMP to do this work?
Thank you. That's a really important question. And as I mentioned, I was a teacher. And I always say that, and I no longer teach in a regular classroom, and I say you can take the teacher out of the classroom, but you cannot take the classroom out of the teacher. And so education and information is really important, and learning is really important. And, you know, I mentioned when I was speaking that the idea that nothing would come of this was unacceptable, that something had to be learned. I didn't know what that was at the time. I was learning as I went, but I did know that there were ways to improve. And I see how organizations across the country are starting to work more with people like me, with people with lived experience. ISMP Canada hired me as the first ever patient and family advisor. And I work on so many different projects and initiatives to bring that perspective to light. This is not a learned experience, it's a lived experience. And so it's really important for me to continue. And I've had such great reception from, you know, folks like you at ACP and across the country and associations and people who are really seeking that information, and that keeps me going. And on a very personal level, this is a very healing journey for me because I feel like it is a way that I can be productive, and it is a way that as a mom I can continue to take care. And so it's important that I continue to do this for me, for my family, for Andrew, for all of us, right? We are all patients at some point. Our loved ones are patients at some point. And so it's important to continue to be safer with medications and with healthcare in the country.
You mentioned you worked as a teacher, but you also worked in a pharmacy. You told me that for 10 years.
I did.
And so what does that background do for you? I mean, you understand, you know, what goes on in a pharmacy and the pressure that the staff is under and how fast-paced it is. So how does that help you in your work today?
It's huge because I have that first, like, you know, you think back about how all of these things play together, and that took me through high school and university, was working in a drugstore and watching the pharmacist just go, and this was a long time ago, and they, you know, were just incredibly busy and eating their lunch while they were working and not stopping for a break. And it was really impactful after all of this happened to sort of reflect on that experience and remember what I watched them go through every day and how they would look after their patients and how they would engage with them. And so to be able to bring, again, that other piece of lived experience to all of you pharmacy professionals, I hope, you know, helps you to understand that I truly know what you do every day and how grateful I am for the time, because I saw it and I lived it for a long time. So yeah, thank you.
And Brett, of course, you lived it as a pharmacist out practicing and have that experience working with pharmacy teams, as you said, as a pharmacy practice consultant. Now you have this new responsibility at ACP to help build the CQI Plus program. I'm curious for your thoughts, your initial thoughts when you were presented this opportunity to take on such an important job with ACP.
Yeah, thanks for that, Barry. You know, there's a few things that come to mind when I kind of reflect back on that opportunity coming around. As a practice consultant, I think one of the things that I enjoyed the most was going into a pharmacy and seeing how they do things and learning from those pharmacy teams. And I would see things that I hadn't thought of. that I hadn't seen other pharmacies do, but that were done really well. And then I could bring those experiences to other pharmacy teams and share them. And so the value of that quality improvement process and the sharing of learnings was really apparent to me. And it was, one of the things I enjoyed most about it was seeing pharmacy teams implement something new and feel really good about it in the end. And so, when the option to get involved with a project like this that was really focused on quality improvement on a broad scale and thinking about patient safety, when that came around, just felt like a really good fit for me. It feels like the right thing to do. The idea that sharing learning when something goes wrong could prevent that from happening to somebody else is just a very powerful idea. And so if through this program we can even help one person avoid harm, and hopefully it's many more, but if we can even do that, I think, that's a success.
I know Melissa, you just mentioned about the busyness in a pharmacy. It's a high-paced job. There's lots going on all the time. Pharmacy teams are busy. We've got shortages of pharmacists for not only pharmacies but communities in general. Same with pharmacy technicians. We always need more to be able to serve communities. I'm wondering, some teams out there might be thinking, boy, this is just one more thing we're going to have to do. Report the close calls, the incidents, to add on to their already busy day. So how would you respond to that concern that this is, just one more item on the list of to-do things?
Yeah, I think that's, probably top of mind for a lot of folks here tonight and those joining us online. It's true. When you go into a pharmacy environment today, it's busy, it's complex. Pharmacy teams are doing more than they've ever done before. And that's a real concern, and something that I think as we're developing this program, we're really trying to be mindful of. I talked about engaging registrants, and that's something we're planning to do to get that feedback and to really understand the impacts on registrants and licensees and proprietors. We're also engaging patients and bringing those perspectives in. It is important to remember, I think, that these are things that pharmacy teams are doing right now, and they're doing a really good job of it. And what we really want to do is help facilitate the sharing of those learnings that they're already doing. And that will actually benefit your pharmacy team as well as you can benefit from those learnings. So I think it's important not to think of it again as something that we have to do, but who we are and what we believe in. Yeah.
We have a question from our chat from the Twitch audience. Would there be any programs for staff members to educate when a record of any incident is made? It is not to blame anyone in the team. Is it more about learning from mistakes?
Yeah, that's a really important point. Again, it's about shifting that culture, right, and moving it to a just culture. And so that really involves not just the registrants, not just staff members there, but also licensees, proprietors. It needs to really involve everybody in that delivery of care. To live that just culture. And so we will be providing some education, some materials to help support pharmacy teams in reflecting on their own culture and also building that safety culture and expanding on it.
Melissa, can you tell us a bit about, you've experienced helping develop these programs in other provinces. So what does that look like elsewhere?
It looks different in every province, but there's so many commonalities. And really the commonalities is that collaboration, and there are many, and we've heard this a lot. How do we have time for one more thing in the day? And it is only together that you have the capacity to be able to do that and to build that culture and to build that into the workflow. And, I sometimes think that perhaps it's a bit of a front-end loader, right, that you have to do a lot to get those processes set up, and then it just becomes part of what you do every day. But I am aware of the draws on people and the draws on staff, and we hear that across the country. We're seeing so much value from the learning that's coming from the reports that it really is such a valued effort for pharmacies to be able to take the time to do that. And then that feedback loop is important too, when you then look at, you know, your progress down the road and you see that, and it sort of renews that, that impetus to continue to doing what you're doing and to continuously improve. So there are many of the same thoughts across the country, and people are really working hard to make this happen because they know the value.
Right.
Yeah.
Another question from our online audience. Brett, I'll put this one to you. How can ACP help us take care of team members who have been directly affected by an event?
Yeah, Barry, I mean, that's a really key piece and Melissa spoke about psychological safety. That's a really, really important piece. And for any of you who have had a chance to review our draft standards that went out for consultation, the standards for the operation of licensed pharmacies. That piece is actually in there and does speak to the need to support team members who have been or experienced an incident. So that is something that we recognize as a key piece of establishing that just culture. And so, you know, we'll be providing some resources to support teams in providing support to their staff members. Yeah.
Okay. Yeah, it was a great question. Will ACP be sharing a summary of the incidents and top incidents on a regular basis with registrants so that we can see that we're not alone?
Yeah, I think this is a key piece, right? Is the information can't go into a black hole, right? We can't ask folks to take time to report and have that information go nowhere. So I don't have all those answers yet about how exactly that's going to happen. That's what we're really focused on right now, is making sure that however we implement this, it brings value back to registrants and back to pharmacy team members. They really need to be able to see that. It's not something that we need to see. Pharmacy team members need to see it.
Okay. And we have a question from our audience here in Edmonton. Go ahead.
Hi, thank you both for both the presentations. It's both kind of a question and a suggestion about the workload and the data management, because I think if a pharmacy is taking the time to do the reporting, they'd like to have a copy or to be able to see it as well, so that worked into the program somehow, that pharmacy's data is able to be seen at the pharmacy level while also going to the kind of global charting. So we're not having to do it in two different areas. I think that would be a helpful thing for pharmacies.
Yeah, thanks for that. And I think that's a really key point. And we should be clear about that. We're not envisioning a system that requires reporting in multiple areas. What we're envisioning is a single solution at your pharmacy that then allows, it will support your pharmacy team in doing that root cause analysis, looking for contributing factors, developing your action plans, all those things that you are doing now, but then helps to share that information into a central database. So what we don't want is to create extra work, because what some of our colleagues across the country have shared with us is that that affects engagement. And when we don't get engagement and involvement, then we lose the power of that information. But so thank you for that suggestion. That's really important.
Melissa, you talked about in your presentation, you know, how we have some provinces are already online with their systems. Alberta is coming, of course. But the dream is to have that map all colored the same color, right? Yeah. What impact will that have? I mean, you've seen the impact on these reporting systems in the individual provinces, but if we go nationwide with data available across Canada, what impact would that have, do you think?
I think it would make a huge global impact. We are looked upon really positively by countries across the world. We know that these kinds of reporting systems are not in place in many places in the world. Some of them, they do have them in place. They are not mandated. I know Australia, I was in Australia a few years ago talking about this, and they look to our systems. So we really have the opportunity to be leaders provincially and nationally to share that learning, and what rich learning to be able to take that snapshot from across the whole country to not only share with each other, but on a bigger scale. Yeah.
Great. We have another question from the audience.
Could you describe what you envision the patient engagement portion of this program to look like?
Yeah, so I think this is something that we're working on, and we're working with some of our patient partners to identify people like Melissa to really try to understand what is the patient's role in the quality process in a pharmacy. How can we support pharmacy team members? How can we support patients in having conversations about quality, about safety, not just when things go wrong, but also when things go right? How do we build those connections? So it really needs to start with identifying where are our gaps right now. And so that's some of the work that we're beginning right now, is to figure out what are patient experiences in community pharmacies in Alberta, and how can we make sure that pharmacy teams are meeting patient needs, and we can bring pharmacy teams and patients together to have those conversations.
And if I can add on to that, when we do our job and when we're focused on our job, we're very much in that expertise. When you bring in a different perspective, things are seen in a different way, and ideas come up, and different ways of doing things are thought of. And when there's reception to those ideas, then that's really the gem, right? That's how the improvement grows. And so hear from your patients, hear their ideas, and once you listen to them and what they have to say, you would be amazed to hear some of the ideas for prevention, some of the ideas for improvement. It's really incredible what people have to say. Yeah.
Right. We have a question at the back.
Yeah, so it was mentioned that this quality improvement planning is going to be both mandatory and anonymous. So my question is, what mechanisms are envisioned in future to ensure this reporting does actually take place?
That's a really good question. So what you're talking about again is engagement, right? So how engaged are pharmacy teams with that reporting requirement? We do have processes in place right now to assess compliance with standards, right? So pharmacy practice consultants go out and they'll have a look at what pharmacy teams are doing on site. What some other provinces have done, and again, we haven't really, we don't have all those answers yet, but what some of the other provinces have done is they've been able to gather some of that engagement data from the national database, from some of the platform providers that provide the software solutions to facilitate reporting. So they've been able to give some information about engagement. But I think, again, what's really important to focus on is not, we certainly want people to report, we certainly want people engaged, but it's if you're not engaged, what are those barriers? And how can ACP support pharmacy teams in breaking down those barriers? How can we make this part of what we do, just like buckling our seatbelt, just like tying our shoes, those things that we do, even though they take a little bit of extra time, but because it's who we are. And so I think that's what we're really focused on, is identifying what those barriers are and working to remove as many of those barriers as possible.
All right, we have another question from our online audience. Will the program include how to assure the patient after a drug error incident? So what kind of support will we be able to give the patient at the other end?
Yeah, so excellent question there. I think we know from what Melissa has shared that obviously bringing the patient into that conversation when something goes wrong can sort of either make or break the relationship and the follow-up to the incident, right? If I can just sort of speak to some of my own personal experience here, I mean, one of the most powerful things that I've found works when there's an error, when a patient's unhappy about something. It might be how long they've had to wait. It might be, we weren't able to hear back from the doctor soon enough. Whatever it is just to say sorry, right? And to really mean it. Yes, this has affected you. You drove all the way here and your prescription's not ready. I'm so sorry. What can I do to fix that? And so again, it's just engaging the patient in that quality conversation and removing those barriers in between. So I don't know what the roadmap is. There's certainly tools that are available out there from healthcare organizations to help support pharmacy teams in engaging patients. And so we'll be providing some of those resources and linking to some of those resources. But again, it's really just about beginning that conversation.
Right. I have another question for you, Brett, about, and I'll actually, this is a good question for both of you, I think. We talk about continuous quality improvement. I think we all know what quality improvement means. I'm intrigued by the continuous part of it, the C. Maybe, Melissa, I'll ask you, why is the continuous aspect of this such a key?
Because there's always learning. There's always new things that rise to the top, and there's always great ideas that come from different people in different environments and different settings. And we have to continuously to self-monitor and assess to see where we are. And I showed you that safety culture ladder, and maybe you're on rung 3 and you self-assess like that, and then you want to move to rung 4, and how do you do that, and what does that look like? And so continuous, really, it truly is just ongoing and learning as you go and finding new and different ways to do things. And maybe there are tried and true ways to do things and systems that work. Can they be tweaked? Can they be changed? Should they stay the same? It really is so, in some cases it's very locally decided, but in some cases it is broader than that. And so we can't stay stagnant. We can, do quality improvement, but part of quality improvement is that plan, do, study, act cycle, that we're continuously trying new things and improving them along the way.
We have a question here. Sorry, I see a hand. Yeah. Greg will make his way over.
Thank you for both of you. I have one question for everyone. So first for Brett, as this new program after completion meant to replace the current one or to be add on and probably to get engagement, so probably we need one system to report. And if we're reporting online and rather than just the paper documentations that we use, I think will be a good thing. Ask the second question, or you'll...
Well, why don't I answer that one, and then you can move on to the next one. That's a really good question. Part of what we really want to achieve tonight here is clarity on where are we moving. We don't, like I said, we don't have all the answers yet, but what's this going to look like? And so, yes, the intent is really that CQI Plus would kind of replace and really enhance what currently exists. So essentially, all that work that pharmacy teams are doing right now to document incidents, to analyze those incidents, to take steps to prevent them from happening in the future, what we're doing is kind of adding on a technology requirement that would happen within a platform, and then that information would then be reported out. And that would be an automatic process, so not something that pharmacy teams would have to specifically do in a separate system. It would all be within one system. Yeah, so it would support pharmacy teams
not
within...
be double reporting like what we are doing now and then what we're doing online.
Yeah, so what you're doing now on paper would occur in the future within this new platform.
Oh, okay.
Yeah,
Thank you.
so it would replace that, yeah.
Okay, and for Melissa, thank you for having you here. Are the programs and the initiatives you've been involved with or leading are only tracking medications error or safety happening at pharmacy level or wherever they are?
There's lots of different ways to track them. The continuous quality improvement programs that I've been advocating for and ACP Canada advocates for mostly at community pharmacies. However, any healthcare provider can report a medication error to ACP Canada, and there's many errors that come in from all kinds of different healthcare providers, anybody who dispenses or who prescribes medications, right, dentists and whoever that might be. So there is mostly community pharmacies who are reporting medication errors and near misses at this time. I am not 100% sure on how hospital pharmacies report errors and what that looks like, but I know my focus is on community pharmacies and the work that's going on there.
Because usually from what I read before, usually the frequency is higher on hospital levels. But are these programs will be involving hospital pharmacies or will not?
That's a really good question. So this program's really directed at community pharmacies at this time, and that's based on what the legislation in Alberta currently allows us to govern as ACP. And so right now this is directed at community pharmacies. But you're right. I think what's important to bring out in the point that you're raising is that there's all these different systems around the country and even within our own province where quality issues can arise. And so, you know, what we're talking about today is really doing our little part of that to collect that information. But that doesn't mean that the information that's in hospital and other sources isn't valuable. And I know there's work happening in those areas, but ours is, to more directly answer your question, is really focused on community pharmacy. Yeah.
Thank you.
Okay, great. We still have a few minutes left here in Edmonton or online. If you have a question for either of our panel members, please raise your hand or join in the conversation online. We just have a few minutes left. We do have another question from our online audience, Brett. They'd like to understand how ACP will track near misses from all of the errors that they catch from prescribers every time a pharmacist resolves them.
So we got a little laugh in the room if you didn't hear that. It's a good question. So near misses, which is a term that we're using now, and we're moving to some new terminology of a close call. And that's following some of the work that Health Quality Council of Alberta has done. But they are a really essential piece of the puzzle because just because an error hasn't reached a patient or caused harm doesn't mean it's not an opportunity for learning. In fact, you know, I've seen some organizations refer to these as gifts, right? It's a gift that's given to us that it didn't reach the patient. And so we really need to action that gift and really respect and acknowledge and value that gift that was given to us. So specifically towards physicians or other prescribers and what they do, this program wouldn't necessarily cover those healthcare professionals. However, there may be learnings that you could share in catching that. And so we really want to empower pharmacy teams and get pharmacy teams to think about, is there an opportunity for learning here? And if there is, then that's something that really should be shared.
Question for me. So we're looking at launching CQI Plus hopefully by the end of 2025. I'm wondering what you're hoping to see from regulated members at that point.
Yeah, so there's kind of a few key components, Barry. We've talked a lot about this technological component. So what other provinces have done, and the implementation's been a little bit different. We're still figuring out what's going to work best in Alberta here, is pharmacy teams would have access to a technology solution that would facilitate, and many pharmacy teams, some of you sitting here and probably many of you joining online already have access to these types of systems for documenting incidents. They basically allow you to enter that incident information, analyze what's happened, establish an action plan to prevent it in the future. But then pharmacy teams would also have a data sharing agreement to allow that information to be transmitted anonymously. So not only no patient information, but no information about who wrote the report or who was involved in writing the report, no information about who was involved in the incident. None of that information leaves that system. That's all yours, just like it is now with your own incident reports. But then that information, what happened, what the learnings were, what were the contributing factors, that moves off into a centralized database. So that technology component is kind of the key component to the incident reporting platform. But if you go on our website today and you look under the quality assurance tools that are on our website, some of those are they've been there for quite some time. So those tools will be updated. They'll be replaced with some more modern resources to better support pharmacy teams in their CQI process. So there will be that piece as well, along with some education pieces to help various members of the pharmacy team to participate in that process.
All right. Thanks very much, Brett. I know there's lots of work still to be done, but I think you answered a lot of our questions about CQI Plus. I know there's a lot of curiosity about what's coming ahead in the next year and a half or so. So thank you for that. Melissa, I want to leave the last word to you. Any final thoughts you'd like to share with our audience tonight?
Thank you. Yeah, I just really want to thank you in advance for your openness to this work. I would like to thank you for the work that you do every day. It does not go unnoticed. We appreciate the commitment you have to your patients and to their safety and their families, and so thank you for that. My wish is for you to continue to do the great work that you're doing, work with each other, collaborate with each other, learn with and from each other, and communicate as much as you possibly can with each other, with your staff, with your patients, with the prescribers, with whomever. That's really such a big part of this, is that communication piece, and it is perhaps the biggest puzzle piece to move this forward and to increase safety for your patients, but also for you. Safety is about patients, but safety is about you as well. So thank you very much for being part of this.
Thank you, Melissa. Thank you, Brett. That was awesome. I am going to turn things back over to Jeff Whistle.
Just want to again thank Melissa and Brett, and of course Barry, for participating in our session tonight. And thank you for all of you for carving time out of your busy schedule to be here tonight. It's really meaningful. Something like this needs to start small, but we will build momentum from here. So thank you so much for being here.